Thank you very much, Dr. Horvath and Pryor. It's a great privilege to be talking to you today. So my task is to say, what do I look for in a new hire? And this is basically my personal preferences. My background is I did fellowships after general surgical residency in portal hypertension and endoscopy, and also in research in GI motility. I'm currently now chair of surgery and the program director for general surgery. So my first job, I worked for a year, and then my chair of surgery was fired, and the department sort of fell apart. I was lucky enough to find another job at Vanderbilt, where I ran into really master surgeons, John Sawyers, Linwood Harrington, Benton Atkins, H. William Scott, Les Williams, that really impacted me greatly. They were all master surgeons, really good technical surgeons, but really also awesome clinicians that most of the time when I went to them with a clinical problem, they said, well, operate. So Hiram Polk was a visiting professor at Vanderbilt, I think that first year I was there. And he came and gave several lectures, and in usual Hiram Polk fashion, he told us, cut well, sew well, they'll do well. So what do I look for in a new hire? Remember my background, remember Dr. Polk. So number one, surgical skills, do you have them? I really want to know if you're a good surgeon. Number two, surgical skills. Are you improving your skill set? Number three, surgical skills. Do you have good clinical judgment? Do you know when to operate and which patient to operate and which operation to do? And then follow those patients up. Number four, surgical skills. Do you have good outcomes? Do you measure your outcomes? Do you know your outcomes, short and long term? And do you really care about them? And number five, surgical skills. Are you engaged in the relentless pursuit of perfection? Are you really looking at everything that you're doing in terms of how you can be a better surgeon? I think surgical skill is a core attribute of everything that we do. I think success in academics is rested upon excellence in surgical skills. The hospitals and patients also look at you in terms of your surgical skill. Our work, bad or good, affects the bottom line of the medical center. And I really don't think you can teach effectively or do research effectively if you're not an excellent surgeon. So let's go on through 6 through 10, what I look for in a new hire. I look for expertise in a particular field. I look for communication skills. Does your background suit the position that I'm looking for? Are you collegial in your approach, and will you be collegial in my facility? And finally, number 10, are you and your family, your significant other, a good fit for the position? So let's go into that a little bit more. Expertise in a field. You've got to have complete command, a knowledge of the literature, both pros and cons, and develop your own data. It always helps to be an expert in which you can quote your own data, your own experience. This is a quote that was up in the wall of one of my physics professors: follow not the well-worn trail, rather blaze a new trail. Communication skills. I think you have to have excellent communication skills for education of residents and students, for referrals, and also for patient satisfaction. I think all those skills are important. Both written and verbal communication skills are incredibly important when I'm looking at a new hire. Does the background fit? Do you have the training required? In other words, if it requires a specialty board, that's going to be incredibly important. Do you have the endoscopic skills Will you be able to get credentials and privileges at our hospital? Do you have the training? Do you have good surgical training? So I really call up your previous mentors and program directors and other surgeons that I know at that program and delve into your surgical training and how you did there. And do you have research experience if we're looking at you for a research position? Is the type of training program you graduated from compatible with my program? Now, I'm located way down south, and my medical center is an indigent care facility. So someone that comes from a very highly directed private practice type community program that does not see a lot of indigent patients may be somewhat astounded by the types of patients that we see at South Alabama in terms of their BMI, comorbidities, thoughts, and language, and presentation at multiple comorbidities in late stages rather than a different type of patient population. Collegiality, I think, is really important. I really do ask myself, will I enjoy working with you? Will you enjoy working in our environment? I think that's a really good question to ask. Is it a good fit for both of us? Will you be a good colleague or a malcontent? So is it someone that's going to come up every day and say, I just love it here working here, and oh, by the way, I've been up all night and I've got several papers due, and the woman at the front desk is being a little bit ugly, but I love working here, okay? I like those people. Now, finally, is your family going to be a good fit for my program? South Alabama, Mobile, Alabama is a very different place from New York City or San Francisco. So if you're married to Lady Gaga, okay, I would submit to you that I can tell you right now, I don't think that it's going to be a good fit for you to have a position in Mobile, Alabama. So let's go on. You've been hired. So first year or so, interaction with others. If you come to me with a complaint, have a solution. Even when you're right about a situation, if you're cursing, yelling at lower level people or high level people or anybody, everybody's been given the authority to make email complaints, formal complaints, and then we go through this process. And I can tell you that a lot of my time spent as chair is all about personnel, about how someone yelled at someone else. And I got to go back and tell them, you got to go back and apologize. You got to go make it right. So don't do it at the first. Ask for advice frequently about patient care, interop, walk around, see what others do. We've got a lot of great surgeons that do a lot of innovative things. You might pick up a few things. You want to be seen at lectures and grand rounds. Ask questions or make an observation with data in conferences. Don't be obnoxious about it, but ask questions, make observations, be, engaged in the entire medical center. Develop yourself, watch other surgeons. Go to lectures outside the Department of Surgery and other rounds. Volunteer for work. It does a huge amount of good for you to volunteer to do a skin screening clinic. It does a huge amount of good to volunteer to take the extra day of call, okay? People notice that. I get emails from the dean, from the vice chairman, the vice chancellor of health sciences, from the president of the university about an interaction they had with one of my surgical oncologists that did a skin screening clinic. volunteer for work, read the papers written by your own department, revel in them, and volunteer to work with it. See what other departments are doing. The medical centers are a wealth of information. There are a lot of good people in all of these medical centers, and I've developed collaborations with the Department of Physics, Department of Medicine, Pediatrics, Endocrinology, biochemistry, pharmacology. There are a lot of smart people out there, and it's amazing what they can do, and all of a sudden you're starting to talk about, measuring with magnetic fields the heartbeat of a rat, and you say, why can't you measure the intestinal activity in a human being non-invasively? And lo and behold, a research paper is written. Finances. I can tell you right now, surgery departments are very stressed. You have to understand billing and codes, understand what it takes to collect. All the insurance companies are doing everything they can to deny, and not let us collect. Get to know the coders and ask about your own op notes and billing to make sure that you're optimizing your billing and collections. We're now entering a new environment. Hospitals used to make lots of money on every single case that they did. Now CMS, Medicare, cuts reimbursement for complications, readmissions, or poor patient satisfaction, i.e. they didn't like the food in their room, so your hospital is not going to be paid for that admission. The other environment is that we're going to capitated care and bundled payments for the hospitals and the surgery departments. So increasingly, everyone is looking for quality care. What does quality care mean? It means less complications, less readmissions, better patient satisfaction. Know your own cost and know your own statistics. One of the best ways you can know your own statistics is using the ACS case log system that will also enable you to develop a good maintenance of certification. Your first year in practice is the hardest of your entire career. You need to transition to truly independent practice. You need to ask for help in the OR. I ask for help in the OR, not infrequently. Usually about 2 or 3 times a year, I have to ask. My very first case at the University of South Alabama was sort of, quote unquote, a straightforward anti-reflex patient, okay? He arrested on adduction, okay? I had to call in the cardiac surgeons. They put him on pump and everything else. There are times you have to ask for help in the OR and about cases. Research. NIH now says that every single science program that they fund must have clinical relevance, okay? I can tell you that there are basic scientists at your university that are anxious to collaborate. They just do not know that you have anything to offer. Work ethic and passion. Michael Lewis wrote the book, The New Thing. It was about Jim Clark, who is the only person in history to found 3 separate 1 billion companies. Okay, he started out as a U.S. Navy sailor scraping barnacles off ships, okay? So can we start the video? This is just a 1-minute video. We're looking great. So, Dr. Rodney, what do we look for new recruits into faculty of general surgery, like this young recruit right here?
Dr. Richards, ladies and gentlemen, we look for that fire in the belly, that passion to teach, to serve, to investigate. That's our modus operandi.
Thank you. So what do I look for in a new hire? Surgical skill and fire in the belly. Thank you.